If you've been on a low histamine diet for months or even years, and your list of foods that you tolerate is getting shorter and shorter, and you're still reacting to those foods, that's not a compliance problem. It's likely that the list of foods that you've been given to avoid is not really designed to answer the question that your body is actually asking. And it says almost nothing about your system's capacity to both process histamine on any given day or what is keeping your threshold unstable in the first place. I'm Dr. Kenny, an IFM certified functional medicine practitioner, and sorting through this exact pattern is a significant part of what I do in practice every day. In this video, I'm going to walk you through 3 persistent reasons that reactivity, even while on a clean diet, is a terrain and a capacity signal, and what that distinction actually means for where your individual investigation needs to go next. Here's what gets missed more often than almost any other piece in this conversation. Imagine a container that collects water from 3 different faucets all at once. One faucet is the histamine that's coming in through your food. The other is the histamine that's produced by certain bacteria in your gut. And a third is your body's clearance capacity that your body has available that day, which, when it's working well, drains the container as it fills. The reaction happens when the water crosses over the top, ultimately, not when any single faucet runs. And the problem with many conversations is we're focused only on one faucet. The food that you blame for a reaction is usually the last faucet that's turned on in this picture. It wasn't often the cause itself, but rather the last input that tipped the scale into the bucket overflowing. This is why the same food that caused a trigger on Saturday for someone might not cause that same trigger on Tuesday. And it makes navigating this food space very difficult for those with high histamine or mast cell activation syndrome, for instance. And the part that makes this very restriction-based approach so hard to sustain, as many of my patients experience, is that if you're managing this by just focusing on the one faucet, taking a food off of the list every time you have a reaction to it, you can run that process almost indefinitely until you're down to 1 or 2 different food sources without ever addressing what's actually keeping the container full in the first place. And that is the frame that tends to shift things for patients when they come to see me. The question of what is filling the container when the diet is already pretty clean. And I want to be honest about what the evidence shows today. A recent 2024 review looked at the current state of low histamine diet research, and it acknowledged that most existing studies have been small, they've lacked control groups in many cases, and they are often used in very short time windows. It's not a reason to abandon the dietary conversation altogether, of course, but it is a reason to hold it more loosely in many ways. And specifically, I believe it's a reason not to treat indefinite or lifelong restriction as the endpoint of the investigation. Don't stop your questioning with the food. To shift focus in this conversation, let's talk about the gut. Your gut represents so much more than just breaking down and absorbing the food that we eat. It is also a very important production environment. We're producing anti-inflammatory short-chain fatty acids from the plant fibers that we eat. We also produce some of our main B vitamins and even vitamin K in the gut. And when your microbiome is in balance, everything is flowing smoothly in the production realm. But when there are imbalances, when populations of certain bacterial species shift towards strains that produce histamine, your gut becomes a major producer and a source of histamine, not just a filter and a processor. So even on a clean diet, even with fresh proteins and reducing the higher histamine containing foods and leftovers, the container can keep filling from the inside. Research looking at the gut environment in people with histamine intolerance found something very important in this conversation. People with histamine intolerance had elevated levels of gut permeability markers like zonulin. Now, it's not a gold standard marker by any means, but what this suggests is that the gut lining has become more porous than it should be, where it lets things through that a healthy barrier would normally block. On top of that, they had significantly reduced diversity in their microbiome, which more variety of species is actually protective, so we're covering more of our functional bases in the gut. And there was one particular genus called Bifidobacterium that was reduced in most participants in these studies. This is a group of bacteria that supports the barrier integrity as well as keeping the microbial environment more steady and stable. What this means for you is that if your gut lining is compromised and your microbial terrain is disrupted and imbalanced, your body's ability to produce histamine is likely already undermined before even a single bite of those fermented foods or leftovers. And no amount of food is going to change that underlying picture going on inside. This is the huge distinction in this conversation between managing histamine load from the outside and investigating the terrain from the inside. The low histamine diet is a load focused tool, and it's a real tool that can be helpful, especially to take short-term pressure off a system. But it cannot do anything for a gut that is actively overproducing histamine, as well as a gut lining that is letting unprocessed histamine through. If you've been on a clean diet more than a year and you're still reacting, this is likely a sign that there are some deeper functional questions worth asking. And if you're experiencing this currently, I've pulled together some of the research that I used in this video. There's a free research summary in the pinned comment in the description below, so check it out. It goes deeper into the studies, and I wrote it to be readable as well as giving you some clinical takeaways in addition to the citations, so check it out. And I'm curious, if you've been managing this yourself for some time, what have you heard from other practitioners in the space about maybe why your diet wasn't holding or similar? I'd love to know what this conversation is looking like for you in real life. Drop it in the comments below. And there's a second layer that I talk about in other videos as well that deserves some attention, that operates completely independently of what you eat. Your body clears histamine through enzyme pathways. The primary one, which is actually in your gut, is called the diamine oxidase, or DAO for short. You can think of it as the gate that processes histamine as it moves through the gut lining. When DAO is working well, histamine gets broken down before it can accumulate in the body's tissues. When DAO is suppressed or depleted, that gate is partially closed and histamine passes through at a higher rate into the bloodstream. The container fills faster, more symptoms arise, and this is often what perpetuates triggers or long-term experiences with histamine overload. And here's a few things that suppress DAO naturally. Alcohol, including small amounts, gut permeability, which damages the intestinal cells that help to produce the enzyme. And here we're talking about gut permeability broadly, which is affected by everything from stress chemistry to inflammatory foods and beyond, which damages the intestinal cells that actually produce the DAO enzyme. Also, depletion of B6 and copper, which are both nutrients that the enzyme requires to function in the first place. And certain medications, including some common anti-inflammatories taken over the counter and antidepressants. Again, notice all of these things do not appear on a low histamine food list. None of them will be addressing these enzyme mechanisms by just removing another food from a list. But every single one of them helps to affect your functional clearance rate of histamine. This is also why historical context in a patient who is reacting to histamine matters so deeply. One of the frames that shifts things in practice with most of my patients that come and see me is looking back on what contributed to their lower immune system tolerance in the first place. And often that history lives earlier than people expect, far before symptoms even started showing up. Childhood gut health or trauma, high performance lifestyle demands, chronic stress, being born premature. The list goes on and on and on. But these all leave very real physiological fingerprints in this pattern when it comes to histamine tolerance. The food reactivity does not just appear in a vacuum, and understanding the terrain means understanding all of the factors and chapters in life that built it. The third piece of what determines how quickly this container fills on any given day is one that explains sometimes the most baffling part of this pattern. Mast cells are the immune cells that are most associated with histamine release. And here's the part that changes how you read this particular pattern. They don't just respond to allergens or immediate triggers. They respond to a wide variety of signals ultimately. Stress hormones, heat, cold, infections, including viral infections, sleep deprivations, certain medications, even toxic exposures. A 2021 clinical review laid out exactly why this produces so many unpredictable multi-systems reactions. When mast cells fire, they release a cascade of inflammatory mediators. These go far beyond just the histamine itself, which is often what gets focused on the most. What this means clinically is that at the threshold where your mast cells fire, this is not a fixed moment. It moves based on the conditions in your terrain and in these systems I just mentioned. And dietary histamine is only one input among many that can push the system over the edge. In clinical terms, this is how this shows up. When a patient is tracking the foods that cause their reactions, and the same food that was fine last week is no longer fine and started triggering a reaction, the question is not necessarily what changed about the food itself. It's what changed about the system's capacity to deal or to be tolerant against that food. Detoxification pathways, nervous system pathways, and that cumulative stress chemistry, the total stress on your system at any given time, all of these shift the threshold line between days even. And that's what makes this so challenging for many people, and honestly, so unfair, that this healing experience requires you understanding this moving target, this moving threshold that sometimes derails the conversation when we get into too black and white thinking when it comes to treatment. For some practical examples, these are some things that can destabilize the system. Perhaps it's a high performance professional in the corporate or finance world who had a high demand week where there was significant sleep disruption or deprivation, a new emotional stressor. Any one of these things can prime the mast cell population to raise that baseline of reactivity in the system. And again, not so fair, but this is the objective stress chemistry piece. So if you've been on a diet that's been clean and low histamine and you're still reacting, the food is real information, but it's not the only piece. Food is powerful when it comes to healing, but it also sometimes gets romanticized in our very food-driven culture. What tends to happen is a patient will experience a reactive food. It gets put on the list of foods to avoid, and the case gets closed, and they avoid it for, who knows, maybe indefinitely. What doesn't often get asked is why the threshold is changing in the first place, and that lives in the systems we just talked about. So when you hit this healing wall and that list of foods is getting shorter and shorter, the investigation from here should turn toward the gut environment first. Microbial balance, barrier integrity, bacterial histamine production, and it looks at DAO capacity and what may be suppressing it. It also looks at this mast cell priming state. What conditions are in the terrain that have been keeping their set point activated? And it looks at the longer history. What came before this loss of tolerance of the immune system, not just what's happening inside it now. And I want to be clear about this conversation that I'm not saying a low histamine diet is wrong or that it does not matter. It absolutely does. Reducing input on a system that's having trouble processing makes complete sense. What I'm suggesting is that restriction alone should not be the focus. Sustained indefinitely, definitely is a question and a red flag to be waved. If what we covered today is a pattern that you recognize in your own story, and you want to see how I approach this kind of investigation in more detail, your next step is to watch the free training that I've put in the description below. It prepares you for a health mystery map call with me if you're in one of the states that I practice in, so that I can get my eyes on your case to see if it's a good fit. And if you're curious to learn more about what are some of the underlying drivers of mast cell activation syndrome, probably ones that you've never heard about, that's the exact question that I go over in this next video here, so check it out. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.